in political parlance.
So is there any chance for any real progress today? House Majority Leader Steny Hoyer is our guest right now from Washington. Good morning to you, Congressman.
Good morning, Gretchen. Good to be with you.
So some of the things that you have said on record in the last 24 hours, I think some people would be startled at, quite frankly. Number one, you say that you're not sure that there are enough votes in the House to pass this thing. Do you really believe that?
No, I don't recall saying that. What I said was, in response to a question, if there weren't enough votes, would there be an option of dealing with a more limited reform package? And I answered that question honestly, yes. That obviously is an option. But like the president, we're all focused on a comprehensive health care reform bill, which we think the American people really will support when they know the component parts of it, because the polling data shows that when you ask not, are you for the health care reform bill, which has been perceived by some as creating confrontation and division as a result of the congressional consideration, but when you ask them about the specifics, do you want to preclude pre-existing conditions making you denied policies? Do you want to preclude annual caps? Do you want to provide for an open, transparent market? And you go down those list of issues that are in the bill, and they say yes, yes, yes to each one of them in very high proportions. So hopefully we're going to move forward on a comprehensive package. But honestly, I think the honest answer is that if you can't do that, you don't simply want to give up and not get what is wanted by the public and what is needed to bring health care costs down.
There's two things going on, and stop me if I'm wrong here. You got to get Republicans to play. That would help. And you got to get Democrats to get along. And we saw Congressman Stupak on this very channel yesterday say the abortion language that I saw in that blueprint the president handed out on Monday, not going to fly with the people that follow me nor me. So in the House, before we get to reconciliation in the Senate, in the House, you have your work cut out for you.
Well, I think, we passed a bill in the House, then we passed a bill in the Senate. That hasn't been done since Teddy Roosevelt first indicated he thought we needed comprehensive health reform. So that we've gotten further than at any point in time in history with Republican presidents and Democratic presidents supporting efforts. So the fact is we've gotten pretty far, and very frankly as well, people have always said, gee, you're not going to be able to get the votes in the House for this proposition or the other, and we have been successful in doing so. Now, clearly, that requires reaching compromises that will allow a majority of people to feel comfortable supporting the bill. But I think we can do that.
All right, Congressman Steny Hoyer, we wish we had more time, but unfortunately with all the news going on today, we do have to cut it short. Thank you so much for being our guest today, and we'd love to touch base with you after the meeting. Thank you.
Thanks a lot.
Okay, straight ahead. Take a look at this duo, modern-day Robin Hood.